Climate change and health. How the occupational therapist's role expands to advocating and educating about the impact on climate change on our health. My name is Steenstra-Church. I'm an occupational therapist and also a member of the nonprofit organization Michigan Clinicians for Climate Action, also referred to as MICA. Their mission statement is reducing climate change's health effects. Michigan Clinicians for Climate Action is a coalition of Michigan health professionals focused on mitigation and prevention of adverse health effects of climate change through educating, empowering, and engaging health professionals, the general public, and policymakers. Climate change is a bipartisan issue that is ubiquitous. As occupational therapists, we focus on health promotion and health management, disease prevention, and reducing health disparities. Occupational therapy intervention uses everyday life activities, occupations, to promote health, well-being, and the ability to participate in the important activities of daily life. This includes any meaningful activity a person wants to accomplish, including taking care of themselves and loved ones, working, volunteering, and attending school, among many others. To provide care that empowers our clients, we first must acknowledge unjust barriers and understand how these factors impact the lived experience of individuals, groups, and communities. We must be willing to be uncomfortable at times and take notice of injustices that may not impact us, but do impact those we serve. Climate change has many impacts, which we will discuss next. Increased temperatures and changing environments have promoted the spread of mosquitoes and ticks that carry these infectious diseases. The prevalence and incidence of Lyme disease have increased. The Michigan Department of Health and Human Services reported 864 cases in 2021 and described the disease as endemic and expanding. I have quite a few friends now who've had Lyme disease, which caused a decline in their health and increased the financial burden in their lives due to healthcare costs for treatment and time missed from work. It is becoming more common for children to miss school due to poor air quality and high allergens, exacerbating asthma, and elderly people who must stay indoors due to poor air quality from wildfires and rising temperatures. Hotter summers also have a more direct impact on health in Michigan. Emergency room visits, hospitalizations, and even deaths from heat-related illnesses have increased in recent years. Higher precipitation is another problem. Heavier rain, snow, and ice can lead to accidents and serious flooding, leading to power outages and decreased access to basic needs such as heat, food, and clean water. Folks who have been systematically marginalized, including people of color and the vulnerable, which includes children, the elderly, and those experiencing poverty and homelessness, are most affected. Abdul A. Sayed, formerly the head of the City of Detroit's Health Department, says the link between climate and health reveals some startling inequities in society. He also states that people of color are more likely to live in the communities most impacted by climate change. They are also less likely to have the resources to be able to adapt to the challenges posed by a changing climate. As a healthcare provider, I see climate change's impact on our patients' lives daily, especially their health and ability to engage in meaningful activities of daily living. Climate change is a social determinant of health. These are the conditions in the environment where people are born, live, learn, work, and play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Healthy People 2030. Healthy People is an initiative by the Department of Health and Human Services with the following objectives. 1. Healthy development and behaviors across the lifespan. 2. Decrease health disparities. 3. Increase health equity. 4. Create environments that support health and well-being. What is the role of OT in climate change? Occupational therapists can advocate for sustainable policies that affect individuals, their environment, and their occupations, and they can use multiple models to guide their practice while considering environmental sustainability and the effects of climate change on people's quality of life. Within occupational therapy, there is a deep knowledge related to human occupation and occupational adaptations, and OTs can provide contributions to sustainable development. OTs are recommended by the World Federation of Occupational Therapy to include sustainability in their work, education, and research. This organization also encourages occupational therapists to widen the scope of practice to include a well population to promote sustainable occupational lifestyles and adaptations to the adverse effects of climate change. So in summary, in our role as an occupational therapist, I urge you to reach out to elected officials of your state legislature. Petition them to support legislation that promotes the goals of Healthy People 2030 and all bills that prevent and reduce the negative effects of climate change. Ask them to please support bills and funding to reduce and recycle waste and optimize access to public transportation. Request financial support and allocation of funds for community-based programs to teach people to respond to climate-related health problems, and to help government plan for health emergencies related to climate change. Lastly, ask for support for preventative resources for community members impacted by the adverse effects of climate change on their health and overall quality of life. Thank you so much for listening to my presentation. Some references are provided as well. And that's it. Thank you.